Hi, my name is Kasia Kynes. I'm a doctor of clinical nutrition, and I'd like to welcome you here to our Epstein-Barr Educational Institute and the Clinicians Epstein-Barr Training Program. Now, I suspect you clicking here and reviewing this video means that you have some concerns about Epstein-Barr, you want to move forward. It's possible that your clients or patients have been asking you to test or to look for it. They have a hunch, they've been reading, it's coming to the media attention. And so what I have to offer you is very unique because in the last few years of my clinical practice, I have actually focused on Epstein-Barr, and I discovered that chronic activated Epstein-Barr is the biggest concern, where people are disabled, they lose their health, they lose their livelihood, and it can kill them. 95% of the global population has the antibodies. Doesn't mean we get sick. I teach all that in the program, and but those that do get sick find that their life is changed forever. And unfortunately, the medical community hasn't looked into it yet. And when I started looking at research and doing literature review, I found that solutions are there. It's right there. Research is there. It is there. I just systemized it. I worked with some of them as clinicians. I pulled things together. I started to apply it to my patients, and the results were mind-boggling even to me. So there are cases when you work with somebody who has a lot of complications, which is often the cause, always the case actually with Epstein-Barr patients, and then you hit the wall and you just don't know, a couple of autoimmune disorders and chronic fatigue and multiple sclerosis and this and that and typical things that you might think they should respond to are not working. And then what do? Well, I was there as a clinician. That's why I kept going. And of course, the best teachers are our clients and our patients, and that's how I started to pursue this. So my answer to you is there are solutions. I have protocols. I tweak them, they work. So you will be able to help a person with acute mono be up on their feet within the second week of the protocol and give them tools, empowering tools that they can carry throughout the rest of their lives, preventing reinfection in the future. That's very powerful, because what I find is that people are living in anxiety and fear of future. And so, let me read you something. Chronic activated Epstein-Barr can be expected in chronic illness which cannot be explained by other disease processes at diagnosis. That's a quote from one study. Another study. In a study of 30 people with chronic activated Epstein-Barr virus over a 68 months period, 10 of them died of liver failure, malignant lymphoma, and other causes. That's a study from 2001. Chronic activated Epstein-Barr and severe chronic activated Epstein-Barr are under the radar, and people are suffering. And if a person is actually diagnosed with chronic or reactivated Epstein-Barr, they're lucky. Most people don't even know what they have. And that's how my story clinically started. I've been working with patients for a long time. And so now I train clinicians like you, what I know, to help you help them and spread the word is very important. So the point is that it hasn't been systematized. It hasn't been put together in one place. People are struggling, clinicians are struggling with scraping by and putting things together a little here, a little there. But I show you, I have a book coming up on this, which will be for doctors and their patients, showing the recovery process. It may take half a year, it may take a year, but there is a recovery. People don't have to suffer and they don't have to lose their lives. So, what about the program? It is I'm a clinician. I want to make it practical. Everybody's busy. So it's an online teleconferencing live program. We're going to do 4 months, 8 sessions, every other week is a session. We start with education, with the training of the testing and test interpretation. All is based on research science and clinical experience. And then we go through the research that is available, what's important. And then we look at cases. I'll show you some of my cases. You'll bring some of your cases when you suspect it, and we'll work through it together. There's a lot of talking. It's high touch. There's a lot of one-on-one connection. So the groups are small and camera, more intimate. It's important that every clinician has some time. You have to be working with patients. You have to be licensed to do it, or clients. So if you're an ND, MD, osteopath, acupuncturist, dietitian, nutritionist, you are so welcome. Now, it's under the radar. It's possible to help people and stop it, reverse it. It's complicated. And now I told you that it is an epidemic. It has a potential to change the way people are suffering all over this planet if we spread the word, get that education out. So now that you've heard me, and now that you see what really is the reality of the population that is suffering and how grave it can be, I'll tell you more. Now that you know that in the last year or so, studies are looking at more of the common types of cancer, like colorectal cancer or breast cancer, and finding Epstein-Barr there. Now that you know how important it is to do something about it, and there are tools, you will feel like me. You will feel responsible to learn, get on board, go back to your clients and patients and help them, because they can be on their feet, empowered with all the tools, living their lives. And that's the bottom line. So I hope I can welcome you to the course. I hope you will join us and get on the journey together so we can get the word out there. Thanks so much.